Sure.
I mean, nobody is actually... Hello and welcome to Focus on Health. I'm your host, Peggy Mello. This series will cover various topics in the area of health and medicine, featuring interviews with local experts. Today's guest is Dr. Keith Nussbaum, who practices chiropractic medicine in Loudonville. Let's meet him now. Welcome.
Hi, nice to see you.
Nice to see you too. So, your practice is on Albany Shaker Road in Loudonville. Tell me about the typical educational background of a chiropractor.
Okay. Normally a chiropractor goes to college for approximately 4 years and receives a degree, either a Bachelor of Science. Sometimes, very infrequently, they can get by with doing a BA degree, which is a 2-year degree. But I myself, I went to SUNY Albany for 4 years and I have a Bachelor of Science in Biology. After that, chiropractic school is on trimester. It's about 3.5 years of curriculum with an internship of about 1.5 years in a clinic. After that, you can specialize in depending what area you want to focus on, whether it's nutrition, orthopedics, or just general chiropractic. I did another year in sports injuries. So in my office, I treat extremities such as the ankle, knee, shoulder, elbow, and such as that. But typically, it's 4 years of college and about almost 4 years of chiropractic school.
In order to be an MD?
A DC, Doctor of Chiropractic.
Okay. Just so our viewers understand the difference between MD, DC, DO, and PT. You want to tell them
Sure.
what that means?
An MD, and most of my good friends are MDs actually, they went to the 4 years of college like myself, and they went to medical school, which is 4 years after college. Then they went to, usually it's 4 years of internship/residency, and then 2 years if they want to specialize. So it's definitely more education. MDs are allowed to prescribe medication, where chiropractic is holistic. You know, we recommend vitamins and such things like that, but no, we're not allowed to write scripts for medication. A DO, a doctor of osteopath, it's very similar to medical school, except they have some training in manipulation, and that's what chiropractors do. We manipulate the spine to achieve better health. The doctors of osteopath can prescribe drugs or medication, and they manipulate. I would say only about 15% manipulate. The doctors of osteopath, after osteopathic school, they either go on to whatever fellowship they might want to do, whether it's orthopedics or obstetrics or gynecology or rheumatology. So they're almost like MDs. PTs, or physical therapists, are similar to chiropractors in a way. They treat the musculoskeletal system, but they focus more on the muscles and rehab and stuff like that. They're not allowed to prescribe medication, and basically you need a referral to go to a PT, where a lot of times with chiropractic, you don't need a referral to go to them.
Okay. All right. And tell me about your practice and about chiropractic medicine.
Okay. My practice, I've been in practice for 17 years, right out of school. I focus on family care pretty much. I see people from 1 month old to 99 years old. As long as a person has a spine, they can be a patient, basically. We treat people who are ill, who are well, who are hurting bad, who are not. I treat tons of athletes, tons of, mothers, housewives, elderly people. So my practice is general practice, and that makes it interesting. No people are, not many people are different, and makes the day go faster. We do physical modalities in my office, such as ultrasound, laser therapy, massage therapy, heat therapy as well, which some chiropractors don't do that. We also take x-rays on the majority of patients that come in. X-rays enable us to see the actual bones of the spine, see if there's any, God forbid, tumors or arthritis or certain things that we would not want to adjust. In my practice, basically, people come in, they fill out a questionnaire, which is a health questionnaire, and I sit with them and we go over it. Then we do a physical examination, and then depending on the situation, we might take x-rays or not. They come back in the next day, we look at the x-rays and get a treatment plan for them. The treatment plan is based on their age, their injury, and their basic general health care needs. After their treatment is done, every single patient is given an exercise program and then recommended either some kind of maintenance therapy or come in on an as-needed basis.
So it's not just come in and see me all the time. It's also
No.
what they can do at home.
Right. My
as
goal
well.
is to not treat people forever, okay? My goal is, A, they're coming to my office because they're in pain. My main goal is to get them out of pain. That's why they're coming, that's why they're paying. Then, my second goal is to educate them through proper exercise, diet, nutrition, rest habits to achieve their optimal health. Okay, everyone's health is different depending on their genetic makeup. So when someone comes into me, even though, quote, maybe it is my goal to keep them as a patient for life where they come in once a year or every 10 years or once a month, but it's to get them better and educate them. So they don't need to come in every day or whatever.
Now, I have some statistics on back pain. The statistics are from the American Chiropractic Association. They say experts estimate that as many as 80% of the population will experience a back problem at some time in our lives. 1/2 of all working Americans admit to having back pain symptoms each year. Back pain is one of the most common reasons for missed work. And Americans spend at least $50 billion each year on back pain. So it's a very common ailment, for sure. So in your practice, basically, what types of ailments can you treat?
Okay, we treat, the most common is back pain, low back pain,
Lower back.
which to the layman person is a sprain strain, which is a strained muscle or ligament or something like that. People strain their necks or their low backs. The reason for this is poor body mechanics. The majority of the population is out of shape, so that doesn't help, and that increases the chances that their back will go out. So I would say about 75% of my patient population is neck and back sprain strains. To get a little more detailed, there's herniated discs. What the discs are, they're the shock absorbers of the spine, and they're in between the vertebrae. So for those of you who don't know what a vertebrae is, you have 7 in your neck, 12 in your mid-back, and 5 in your lower spine. And the vertebrae is what protects the spinal cord. Nerves come out the spinal cord at each level. Those nerves go to your arms, your hands, every part of your body.
All of your body.
When someone hurts their back, the majority of times it's just a muscular injury. But the more severe cases, their disc can be injured or protruded or herniated. You might have heard the expression. So when that disc is herniated, what happens is the disc bulges out and it can touch the nerve. I don't know if you can see that, but so when the disc touches the nerve, that's a more serious condition than just a muscular sprain strain, and that takes a lot of time. So what we do in our office, through the use of modalities, we relax the muscles to loosen up the patient, and then we put the vertebrae in the proper alignment. By doing that, you enable the body to function at its optimal level and more normally. Biomechanically, when people are in alignment more than they're not, their body will work better. It's like a car. If you have a Porsche, okay, you're going to get it tuned up religiously. You're going to get the oil changed, every 3 months or 3,000 miles. You're going to have the tires rotated, blah, blah, blah. I try to tell every patient they're like a Porsche, okay? By keeping your Porsche in alignment, it's going to work better. By not, it's the same thing with your back. The less you take care of yourself, the more weight you gain, the more you indulge, the less proper body mechanics you use, the more likely your back will go out and have a problem. So, we treat, that's the majority of problems that we treat. Then, if you have another question.
So what can a person expect when they go into your office, they go into a treatment room?
Okay.
Generally, what would you do?
Okay, first they come in, we say hi, we're very friendly, obviously. You get a questionnaire telling me about your problem and about your past history, whether your parents are alive, what medications do you take. That is very important in determining the need for treatment and the mode of treatment. After that, we do a physical exam, which is similar to a medical doctor. It consists of range of motion testing, orthopedic testing, neurologic testing, and then based on the exam results, we usually take x-rays to see the body, to see what the spine looks like. After that, the person comes back in, we go over their whole case history, and we get a treatment plan, whether it's twice a week for 4 weeks, or once a week for a week, or every other day, or whatever the situation might be. Typically, the treatment plans are between 6 and 8 visits. Typically, one visit doesn't get the person better. After the treatment plan is completed, we usually give the patient an exercise program, and then we discuss if they want to continue with a maintenance type plan where they get adjusted monthly to prevent injury, or basically call when is needed. So typical treatment, the person comes in after we go over their case. They usually receive some kind of electric stim or some kind of modality to relax their muscles. Then we do a massager to relax the muscles.
Now that sounds scary, but
Well,
just so you can describe electrical stimulation.
Okay, what it is we have interferential machines, high volt machines, ultrasound machines. What it is, through the use of electrical impulses, it causes the muscle to relax and change the tone, which gives the person relief. So I would say about 70% of the patients receive that at the initial onset of their care, because most people come in because they're in pain, you know. And so this helps relieve the pain, relax the muscles, and enables us to get the adjustment in better with less discomfort. So we do that, and typically each visit's 15 minutes, 15 to 20 minutes. The adjustment itself takes a minute. Basically, you just go down the spine, you feel what vertebrae are out of alignment, and you put them back in alignment. But depending what the problem is, they might not stay in alignment, and that's why the reason for continual care. And that's why people say, oh, once you go, you got to keep going. You know, that technically isn't true. Once you go, it takes a certain amount of time for you to hold the adjustment, and then depending on your healthcare needs, it feels good, and you realize that your body works better. People usually stay patient. You know, whether it's once every month or once every 6 months or whatever.
So we've heard about that scary cracking noise that happens when you're doing an adjustment. Can you explain exactly what that is?
Okay. what the cracking is, that pop, is nitrogen gas coming out of your joints. You have joints in your fingers and your shoulder, all through your spine. Every part of your body that moves is a joint. At that joint, there's a space. That space gets filled with nitrogen gas. Once that space is dissipated, is moved, there's a release of the gas, which is a release of a noise, and it's a release of pressure. That's why it feels good. That's why you see people in the gym all going like this, doom, doom, doom. It's not terrible to do, but what they're in essence doing, they're just rotating on the joint. They're like wringing out a towel, and they're getting the pops. What we do, we specifically go to the point that's not moving and put it in motion, and usually that spot is locked up and you get a pop. Now the cracking of the knuckles, everyone asks me this, the knuckles bend. What most people do, they go like this. What that does, that rubs the joint surfaces together and you wear out the cartilage.
Which is bad.
Bad. What you should do if you want to crack your knuckles or loosen your fingers, you want to go like long ways. That's the way the joints move. So when I adjust someone, I adjust them in the proper body mechanics or biomechanics that the joint moves.
And I think another part of the treatments that people hear about or they're afraid about is the neck. When you're taking the head and turning it to the side, and that's also causing a lot of cracking as well.
Well, the neck is louder because it's by your ears, and people use their necks all the time. They're on the computers constantly, they're watching TV constantly, they're driving constantly. The neck is a big area for stress, so that area gets locked up. So when that pressure is released, you hear, a louder noise. And like I said, it's by your ear, so it sounds kind of like an explosion, but it can't hurt you. Sometimes, once in a blue moon, people are sore after they get adjusted, but more like a muscle sore, like they worked out for the first time, or weeded the garden for the first time. But as long as the proper history is taken and the proper examination is done, there should be very little risk of any problems.
So this is not treatment that has to be done forever or on an indefinite basis?
No, I mean, like I give my patients the same speech, okay? I'll never twist your arm to come in. I basically look them in the eye and tell them what they need. I truly believe, and my goal, like I said before, is to get them out of pain. That's why they're there. That's why they're paying the copay. They're coming to me to feel better, okay? Once they feel better, I feel it's my job to educate them how to make their body work better. Whether it's coming to me once a month or when it snows, when they play golf, whatever, you know, everyone's different. Financially it's different too. So depending what their needs are, and financial, aspect is denotes when they come also. But typically, I truly believe that once a month to keep your body in alignment is like going to the dentist, like getting your car tuned up. It's going to make your body work better. Now, besides doing that, just getting adjusted isn't going to, keep you from preventing injury for the rest of your life.
Yeah.
You have to eat right. You have to exercise. You have to use good body mechanics. You have to get the proper rest. Okay, and I like to take those things as spokes on the wheel. If you got all 5 spokes going, your wheel's going to turn better.
Mm-hmm.
The more out of shape you are, the less you exercise, the less common sense you use when lifting things, the more chance your back's going to go out. And that's, what I try to preach to my patients. Everyone's genetic makeup is different. Everyone doesn't have a Rolls-Royce body or anything like that, but by putting the proper food and nutrients in and taking as good a care of yourself as you can, you'll keep it to a minimum. Like arthritis, okay? If your mother or grandmother had bad arthritis, you're going to follow in the footsteps. It's like curly hair. If your mom's hair is curly, most likely yours would be too. Mm-hmm. By taking care of yourself and stretching and keeping your abs strong and using good body mechanics and eating right and proper rest, your arthritis, instead of being terrible at 50, will be bad at 70. And that's the same with heart conditions or whatever genetic makeup you have.
So let's talk about coverage. Not only health insurance, but workers' compensation and no fault as well. We know that the American Medical Association accepted chiropractic medicine as legitimate care in 1978. So the HMOs are on board with it. They're covering it in general, right? So they just pay whatever copay it is.
The patient pays the copay,
Yeah.
correct.
And but there's also workers' compensation and no fault benefits as well. You want to just mention that really quick?
Every state is different, first of all, okay? In New York, I have my license in Florida and Connecticut. The laws are somewhat different there. In New York State, I would say 98% of the insurance covers chiropractic. And basically, some need a referral, some you don't. For workman's comp, people hurt at work, you do not. For no fault, car accidents, motor vehicle accidents, you do not need a referral. The way it works with no fault, it's governed by the state, and there's a set fee. The patient is not responsible for anything except they might have a deductible depending on their insurance policy. Mm-hmm. The no fault and workman's comp are covered for an indefinite amount of visits. Usually every 8 weeks you're allowed to re-examine the patient, and then depending on the length of the case, the insurance company usually sends the patient for an objective examination by another doctor to determine if the treatment's still warranted. So the patient's covered. I would say 25% in my practice, no fault and workman's comp. The majority is major med, PHP, MVP, Blue Cross Blue Shield, Guardian, Aetna, stuff like that. That's what people have up here. And the way it works with that, about 50% of the time they need a referral from their primary doctor, which we very seldom have a problem. Most doctors are chiropractic friendly. As long as you do a good job, send them a follow-up report, which we always do, and basically get the patient better. That's what they want to see. The insurance in this area, there's copays. Usually the copay ranges between $10 and $30 a visit is the copay, and there's nothing you can do about that. That's your plan. Usually the higher the copay, the less the premium. So, if you have a problem with your copay, you should talk to your employer.
Okay, so how can a person avoid injuring their back and neck?
Okay, like I said before, just going to the chiropractor isn't the only thing you can do, okay? That's just a small facet of it. You need to keep yourself in as good a shape as you possibly can for your genetic makeup. That's keeping your abdominal muscles strong, doing at least some kind of cardiovascular stuff 2 to 3 times a week, and doing some light workouts, okay? Like I'm 43, I'm not 23 anymore. Today I did a half hour on the elliptical and I did a little weights. I'm not going to spend 2 hours in the gym, I don't have time for that anymore in my life. But by doing that, it keeps my body as good as it could be for me. Now, by keeping yourself in as good a shape that way is one facet. Eating properly. The better you eat, the better you feel, and the better your body's going to work. And I used to give these lectures in my office all the time. If you have a Porsche, you're not going to put, clunker fuel in. I always say you are is what you eat. Life isn't 2 all beef patties, special sauce, lettuce, cheese, pickles on it, and onions on a sesame seed bun. So the main thing is by eating right, you'll get better use out of your body. So that's the second thing. Proper rest, okay? If you're tired and run down and stressed out, you have a greater chance of hurting yourself because your body's not sharp, okay? That and good body mechanics. When you are lifting stuff or you're cutting the lawn or you're taking out the garbage, you got to have your body in a nice neutral position with your knees bent and not putting so much pressure and torque on your spine. By doing that, you'll keep the chances of you injuring yourself to a minimum.
Now, and I've also heard about the importance of ergonomics in the workplace. If you're sitting
That's
at a
key.
computer all day long,
Sure. Your computer should
where do we have to be?
You should be a nice, normal level with the screen. Now, the problem is you go into these big companies and every computer is at the same level. And you have girls 5'8", girls 4'8", all different sizes, shapes, and everything. And you all got the same work terminal. So the tall ones are going to get neck strain. The short ones are going to get carpal tunnel. It's a beautiful thing for chiropractic, but if you're the employer, it's going to increase your comp rate and stuff like that. So I know there's programs all around ergonomically where someone comes in, either a chiropractor or an orthopedist or an internist who specializes in ergonomics, and they'll evaluate the workstation. The bottom line, if you feel stressed when you're doing anything, you're not doing it right, or you're doing it too long, and you should take breaks. I tell every patient, if you're on the computer all day, which probably 60 to 70% of people are during work, you got to take breaks. By breaking up that tight muscle, if you're just like this all day, you got to take a break and stretch it out. By doing that, that would decrease your chances of going bad. And at night, if you're sore, the proper use of wet heat or ice or just even taking a hot shower, it makes a big difference. And I try to tell every patient that also.
And also the mattress and the pillow
Sure.
are essential.
I recommend a good firm mattress. You don't want like a loose, mushy water bed, even some people like them. I generally recommend a good firm mattress to give you support. As far as the pillow, the same thing. An ergonomic pillow with a little groove in it to keep the curve in your neck will decrease the pressure on your neck muscles. Because if you go to sleep like this, you're going to wake up like that, probably.
And your neck's not going to like it.
No, or your body. So, and also without selling chiropractic, getting adjusted periodically makes your body work better, and that's the main thing. But you got to do all that other stuff in conjunction to make you as good as you can be, and that's our goal all the time.
So what about women wearing heels?
Terrible.
How much
it
does that
looks
affect
good,
them?
but what happens when the heels, they increase the spine angle, kind of lifts up their butt and puts pressure on that one angle in the spine. Obviously you're going to wear heels, but if you have a back condition, you should stay away from high heels and inclines because that puts more pressure on that disc, like I explained before. And it's not someone who wears heels once. It's people who wear it chronically. It's like sitting on your wallet. People, it's the funniest thing. They have these wallets that are this big, and they sit on them. And what happens is that shifts their pelvis around.
Mm-hmm.
If you were in the park with your husband and there was a rock this big, you wouldn't sit on it, right? So what that does, that's another thing that I see all the time in my office. They sit on the wallet and it shifts their pelvis around. It's the craziest thing.
So every day you get up and go to work, you must enjoy what you do.
I love it. It's great. Like any job, it gets redundant to a point, but what's good, what I enjoy about it is everyone's different, like I said before. I have little babies that come in with their moms. I have elderly people that, are wise and have something to offer. I have housewives and mothers. So every day is different. And what's great about chiropractic is there's a lot of love because people usually come back. So it's not just like one visit and give them a pill, they go home and I see them in a year. usually you see them on a repetitive basis, and you build bonds and relationships. And like I said, I've been in practice 17 years. I have, now it's crazy, I have kids of parents that have been coming to me. And I'm already in third generation, which is crazy. And, that makes you feel good about what you do. Also, it's a very hands-on profession. So there's a lot of love, I don't hug every single patient that comes in, but after seeing someone 5, 6, 7, 8, 9, 10 years and helping them out, and most people do get better when they come in, there's a lot of positive energy. And when I was in school or undergrad, I worked with a chiropractor over the summer, and I just loved the relationships he had with his patients. And that's what really turned me on about chiropractic. No one, God forbid, dies on you. There's no blood or anything like that. And, I always worked out and played sports, and a lot of it's very physical. It's a physical kind of job. It's mental too. You have to determine what's wrong with the patient, but it's very physical. It's very hands-on, and basically my day goes so fast.
And it's a very fast-paced environment.
Right. We're very busy in our office.
Flitting from place to place to place.
Right. In our office, we're very busy. We see a lot of patients. We get a lot of people well, and my day goes fast. Okay, I'm there 6 in the morning to 7 at night most days, except for Thursday, which I'm here. And my day goes crazy fast, and that's great. I don't even look how busy I am. It's just every day is, before I know it's the end of the day. So until I get bored, I guess I'll keep doing it.
Well, typically, how many walk-ins do you get?
Well,
is it mostly appointments, or is it
yeah,
mostly...
I would say 90% of the patients are appointment. It's just hard to people just coming in off the street. But I've been there 17 years. I probably have over 10,000 patients that they don't all come, obviously, but they're out there. And, today 3 might hurt their back, raking leaves. 2 might strain their back at the gym. God forbid, 1 might get into a car accident. It's just the law of averages. People come in, and that's what makes it interesting. You never know who you're going to see. Like yesterday, for example, I saw 2 patients who I haven't seen in 5 years. They're both pregnant. It's a nice thing, It makes your day when you see something like that.
So you became interested in chiropractic medicine when you were getting your bachelor's?
In college, at first when my mom wanted me to be a doctor, blah, blah, blah. And I was in college, and I was doing pretty well. I was at SUNY Albany. And the more I looked into medicine, it was just so many years after school and so many years after medical school. I didn't want to start working at 35. Chiropractic, I make my own hours. I choose to work a lot. If I want, I could probably just work, Monday, Tuesday, Wednesday, and take off the week. But what I liked about it is the relationships you establish with your patients, the bond that you get with your patients, and you get people well. There's something to be said about getting people well. Mentally, I don't know if I could deal with doing brain surgery and having half the people die on me or whatever, even though
seeing sickness a lot more.
There's something to be said about that, because you do save people, and that's a great feeling. But when all's said and done, most of the time when I drive home at work, at the end of the day, I have a smile on my face and I say I had a good day. And that, that's what life's all about to me anyway.
Sounds like a great thing. Well, thank you so much for coming.
It was totally my pleasure.
It's been great.
Yep, it was my pleasure.
And thanks for joining us. We'll see you next time.